Will your neighbor lose their Medi-Cal coverage? It's possible. Medi-Cal is under threat. Hello, I am Kevin Canals, an independent health insurance agent in California and a Covered California certified health insurance agent. And since the onset of the Affordable Care Act in 2014 in Covered California, I have enrolled hundreds, if not thousands, of adults and children into Medi-Cal. And this all is from the expanded Medi-Cal of the Affordable Care Act. Now, we call Medicaid in California Medi-Cal, and if you go to the Medicaid.gov website, you'll see that they're talking about the eligibility of the expanded Medi-Cal, which happened under the Affordable Care Act. And they note that Medi-Cal in California has expanded to include low-income adults. So, and that is just based solely on the income of the individual, not the assets, just the income. So what are we talking about in terms of income? Well, for 2025, the modified adjusted gross income Medi-Cal, that's what it's the income estimate used for Covered California and also eligibility for Medi-Cal. A single adult making less than $1,801 per month would be eligible. That's an annual income of $21,597. A married couple with an income less than $2,433 would be eligible for the full scope Medi-Cal. That's $29,187. And that kind of full scope Medi-Cal, there are no premiums, no cost sharing, prescription drugs are covered. So it's a real lifesaver for many individuals that have low incomes in California. And you can see 37% of Californians are enrolled in some form of Medi-Cal. Now, that's not all expanded adult, Medi-Cal. There's other programs. There's lots of different programs, but they all are kind of tied in some way with the federal government and Medicaid. And the Republican administration, many Republicans, they just want to do away with the Affordable Care Act and radically change Medi-Cal. And that will hurt our neighbors. So because this is political, unfortunately, people have been putting together data, statistics to educate folks, especially members of Congress back in Washington, D.C. And this happens to come from the UC Berkeley Labor Center. And what they did is they went through and they looked at the congressional districts and tallied up the population that was enrolled in Medi-Cal and Covered California in those congressional districts, because most of this is done at a county level, and the congressional districts may have more than one county or only a partial county. So I'm going to focus just on 3 congressional districts. One of them happens to be mine. Congressional districts 1, 3, and 5, they are all Republicans, and they represent 735,000 people enrolled in some form of Medi-Cal. Over 100,000 residents in those congressional districts enrolled in Covered California receiving the subsidies for health insurance. And that is important because if they do away with the Affordable Care Act or they radically change the formulas, that means the subsidies may drop and then people won't be able to afford health insurance and they'll drop that. If there's no expanded Medi-Cal, people just go uninsured. And so those 3 congressional districts represent 836,000 people receiving some form of subsidized health insurance or help for their health insurance. So looking at Congressional District 1, Doug LaMalfa, 322,000 people in his district are receiving some form of Medi-Cal. Another 31,000, 4%, are in Covered California with the subsidies. So 46% of the residents in the congressional district back in 2024, and it may be higher now, were receiving some form of help for their health insurance. Now, Congressional District 1 is huge. Takes in part of the northern Sacramento Valley. You can see Chico, Redding, and it goes all the way to the Oregon coast. And very rural, not a lot of industry. I'm going to focus just on Siskiyou County, where 18,953 people are in some form of Medi-Cal in Siskiyou County. That's 43% of the population based on 2020 population estimates. Siskiyou County is just beautiful if you can ever get a chance to get up there. They have Mount Shasta, there's trails, there's hiking. It's just a beautiful area to live. I can see how someone would just want to live there, maybe not making a lot of money, but just really enjoying that country and the neighbors that also want to live up there. When we dig a little bit deeper into the Medi-Cal numbers for Siskiyou County, 34% of individuals ages 19 to 44 were on some form of Medi-Cal, and 22% of people ages 45 to 64 were in some form of Medi-Cal. And a lot of that is the expanded Medi-Cal, because at 65 you go into Medicare. So a significant portion of the adults in that Siskiyou County are receiving Medi-Cal, and there's probably many people that never applied for it. Congressional District 3, Kevin Kiley, 174,000 people in some form of Medi-Cal, 37,000 people enrolled through Covered California receiving subsidies. So 36% of his congressional district is receiving help for their health insurance. Now, District 3 goes way up to Sierra County and then picks up parts of Placer, El Dorado, around Lake Tahoe, and then down through the east side of the Sierras, 395, Mono, and Inyo County. So large, very, a lot of just open country, rural, really beautiful, just beautiful to drive through and camp in. So, but a lot of people there on Medi-Cal. Tom McClintock, Congressional District 5 is right to the west. That's the mother lode, the gold country for the most part. And Tom McClintock's Congressional District has 239,000 people in some form of Medi-Cal, close to 32,000 or 4% in Covered California. So 35%, over a third of the population in some form of assistance, Medi-Cal or Covered California, for their health insurance. And these are all Republican districts. And the Republicans, by and large, want to do away with the Affordable Care Act and the attached ACA Medi-Cal expansion. Statewide, 5 million children, over half of all children, are enrolled in some form of Medi-Cal, usually the Children's Health Insurance Program. 2.2 million seniors and people with disabilities, which I thought was higher. Now the seniors, that is generally people who have Medicare, but they have a low income, so they're able to participate in the Medicare Savings Program that helps pay for their Part B premiums and original Medicare cost sharing. 3.4 million working Californians, 1 in 5 all workers. And I'm assuming that this probably also grabs college students, because I have enrolled lots of college students into Medi-Cal. If you go to a community college or a CSU, they don't provide health insurance. The UC system does provide health insurance, but if you're going to one of the other two institutions, There is no health insurance. Private colleges also offer health insurance. But there's a lot of people, a lot of young adults, they can't afford health insurance, so they can get into the expanded Medi-Cal and focus on their studies. And like I've told many young adults starting maybe a small business, I said, just get into Medi-Cal so you can focus on your business and not worry about, expensive premiums, so you can really do your new venture justice. But all told, 4.8 million people in 2024 were touched by Medi-Cal. Just huge. And this particular pie chart shows that over 7.7 million people ages 21 to 64, or 52%, were in Medi-Cal. So these are working people. These are working adults. These just aren't all children or people with disabilities. These are our neighbors. This bar chart here is good because it does break out the ACA expansion of adults 19 to 24, because there are a lot of different programs within Medi-Cal. Not all of them are directly related to the Affordable Care Act, but many are touched by the Affordable Care Act. But the ACA expansion, 5 million people in expanded Medi-Cal. You can see 2.3 million on Medicare and Medi-Cal for disabled. So a lot of people, you're just walking your dog, seeing your neighbors. They may not be on Medi-Cal, but maybe their spouse, maybe their children, maybe their relatives. People throughout our communities, some at higher rates in some counties, are touched by Medi-Cal. And if it goes away, it is going to be a huge burden. Now, what I was talking about earlier about the congressional districts, most Medi-Cal is done at the county level. And this map shows the percentages of people in some form of Medi-Cal within the different counties. And some of the counties are over 50% of the population. Lake County, 52%. Down in the central San Joaquin Valley, Merced, 54%. Madera, 53%. Fresno County, 54%. Tulare County, 63%. Kern County, 53%. Imperial, down by the Mexican border, 56% of the population is in some form of Medi-Cal. And as we can see from the statistics, a good chunk of that is expanded Medi-Cal. So as you walk through your communities and talk to people at stores and you're just out on the trails and your neighbors, more than likely they are connected, if not themselves, with some form of Medi-Cal. Maybe they have Medi-Cal because they have Medicare. Maybe their children are on Medi-Cal. That's not something we wear on our sleeve. Oh, hey, look, I'm a Medi-Cal enrollment person. No. But it's throughout our communities. And if Medi-Cal is drastically changed, it's going to hurt our neighbors. So if you have any observations or comments, you may leave those down below and I'll respond to them if I can. Otherwise, for InsureMeKevin.com, I am Kevin Knaus.